on how to deliver effective brief intervention. Our learning objectives for today is to define SBIRT and understand the screening brief intervention concepts, to understand the correlation between the stages of change, SBIRT, and the motivational interviewing, promote SBIRT as a standard of care in the healthcare system and practices, and understand how to deliver brief intervention to provide the appropriate level of care, appropriate level of intervention based off screening results. Our agenda for today, first, we're going to discuss what is SBIRT. Then we will discuss why use SBIRT. We will talk about how effective is SBIRT and how to incorporate motivation interviewing in SBIRT. And lastly, we will discuss how to implement SBIRT in a healthcare setting. So what is SBIRT? Have anyone heard of SBIRT before prior to today? I see some no's. Okay, so let's get into what is SBIRT. SBIRT stands for Screening, Brief Intervention, Referral to Treatment. It is an intervention based on motivational interviewing strategy. The primary goal of SBIRT is to identify and effectively intervene with those who are at moderate or high risk for psychosocial or healthcare problems related to substance use. The S in SBIRT is the screening portion. That's the universal screening that quickly assesses the severity of substance use. It also identifies a patient for risky substance use behaviors and the appropriate level of treatment. And this process of assessing risk can be in the form of a pre-screening, like the pre-exam questionnaire, or just a brief conversation with your patient. Brief intervention, which is the BI portion of SBIRT, it's that brief motivation and awareness intervention for those who engage in risky or problematic behavior. This is the chance to implement brief behavior changes, strategies to help focus, helping the client reduce unhealthy substance use. The next portion, the RT, is your referral to treatment. So this referral to treatment provides those identified as needing a more extensive level of treatment. It's the pathway for brief treatment or specialty substance use. So this diagram here, it is, to explain the risk of opioid. So adults who receive prescriptions for an opioid pain reliever prescription, the likelihood of the chance of opioid use increased around that third day. If you see it on the diagram, it increased by that third day, but it spiked even higher on the 5th day. So the 5th and your 31st day is those days where the likelihood of someone becoming continuing long-term use of opioids. It's more noticeable in year 1 and year 3 of these spikes in continual dependency on opioids. The 11, oops, my apologies. What? Skip. I'm sorry. Here we go. Sorry about that. So the 11 criteria outline of the DSM-5 TR can be grouped into 4 categories. That's your physical dependency, your risky use, social problems, and impaired control, resulting in this list that's showing. So why use SBIRT? Here are reasons to use SBIRT. It normalizes screening of all individuals. It's a great conversation starter between the provider and the patient. It quickly identifies those used for risky behaviors, and it provides patient with self-awareness of any potential problem areas. It prevents substance use disorder related disease, accidents, and injuries, and it also reduces healthcare cost utilization. Here are, you probably identify many of these payers and policymakers. SBIRT is endorsed by all of these that you see before you. SBIRT is a billable service. SAMHSA is working with the Centers for Medicare and Medicaid to educate providers and practitioners on how to do the billing and coding portion for SBIRT. With Medicare, typically they cover around 5 canceling services. Medicaid, that's a state determinant. They determine the duration, the amount, and the benefits of it, same with your private insurers. So how effective is SBIRT? Research has shown SBIRT to be very effective. It's very beneficial in reducing DUIs, healthcare costs, decreasing future hospitalization visits. It decreases the patient alcohol and drug consumptions, and it reduces those readmissions for those trauma-related incidences resulting after those risky drug and alcohol behaviors. So how would we incorporate motivational interview into SBIRT? This is an overview of the theoretical framework of change. This diagram explains the individual's readiness for their behavior change and describes the process of behavior change in the occurring stages. It's important to recognize that in this stage that it's a cycle model, and the patient can also regress in this model, but it's important to always keep it flowing and encourage the patient to continue to move forward, for forward progression using positive encouragement for that patient. The stages of change model here shows that it describes how an individual or an organization can integrate new behaviors or goals. At each stage, different intervention strategies will help the individual process to the next stage. And it can vary at each stage. Individual willingness can vary at each stage depending on that person. So you heard me say the word motivational interviewing. So motivational interviewing, that's the book definition that's showing that's a client-centered, evidence-based, goal-oriented method for enhancing intrinsic motivation to change by exploring and resolving ambivalence within an individual. So long story short, it's just a simple, compassionate conversation between the patient and the provider to promote a positive change and motivation for the patient to make a positive change, whether it's decreasing alcohol use, just lowering the risk, or completely stepping away from that behavior. So these are just your spirits of MI, the collaboration, acceptance, evocation, and compassion. This diagram is a diagram of ambivalence. That's that tug of war, that back and forward stage, something that we all face. Motivational interviewing helps alleviate ambivalence. And together with SBIRT motivational interviewing and the stages of change together, it makes it easy to cooperate this evidence-based practice to quickly reduce the risky behavior and encourage a more positive change, either lowering the risk or referring them on to treatment so they can receive a deeper level of treatment outside of a primary care practice setting. So why motivational interviewing? It is an evidence-based with over 1,400 clinical trials. It's effective in reducing maladaptive behaviors such as those problem areas of drinking, gambling, risky behaviors of smoking or overeating. And it also promotes adaptive health behaviors, your diet, exercise, medication compliance. The practical application of SBIRT, we'll look at that. So the brief screening portion of SBIRT, that's those few pre-screening questions that I mentioned earlier. It's done by either, usually a check-in on a quick survey questionnaire type thing or the conversation. If those answers are affirmative, then they move on to the full screening portion. Again, those additional questions would take about 5 additional minutes. From those answers, if they're affirmative, you move them on to that brief intervention stage. And this is where, as physicians or healthcare providers, we jump in and provide the patient, of course, with the patient's permission, insight and awareness of their behavior or substance use that may put them at a more risky area. And from there, if you identify the patient needs more intervention, then you refer them on to treatment. So the brief screening stages, as I said, it's the three pre-screening questionnaires. The question asks typically about alcohol, because that's what the SBIRT was designed around, alcohol. But they later implemented one question regarding drugs. It is only for patients 18 or older. And this is an example of what the pre-screening looked like. And so from here, once you give this pre-screening to patients, 75 to 85% will screen negative. So those that don't, this would be your 15 to 25% patients. They would complete the audit or DAS test. And this again takes about 15 to 20 minutes to complete. If the answers are affirmative, you move them to your next stage. But we're going to look at the assessment for the direct intervention. They are categorized in risk: low risk, which recommends brief advice; moderate risk, recommend brief intervention. This says a peer support specialist. That's kind of a new role in the healthcare world. Most people don't have them. So typically it's nursing staff or social work type level of providers. Your high risk, you refer them on for those brief therapy and extensive treatment. And of course, you're very high risk, they'll go on to be referred for treatment as well. Third step, brief intervention, like I just mentioned about the peer support specialist, a new role in the healthcare world. But with anyone who completes it, whether it's the nurse or social work provider, a good framework to use in this stage is your 5 A's to ask the question. So you want to ask about alcohol. You want to advise them to quit with a clear, personalized message. You want to assess their willingness to quit, and you want to arrange follow-up and support. So again, brief intervention, it's that motivational interviewing centering around positive conversation without using non-judgmental language, encouraging them to alleviate that ambivalent stage, to identify a positive thing to encourage them to lower their risk, and to identify a motivation to change. The brief steps of intervention, you're going to build a rapport. You want to initiate that conversation. Provide the feedback, going over and reviewing the possible impacts of substance abuse. You're going to build the readiness to change, giving results, those standardized measures, have those discussions, negotiating a plan, if the client is willing to create a plan to lower their use or, again, eliminate the use. Brief advice. This step, it takes about 3 to 5 minutes if you don't have time for the brief intervention stage. So that is just doing the visit. As a provider, you would want to include feedback, your expertise or advice, and set a goal that they can work on, and acknowledging the concern, but something that they can work on towards between that point and that follow-up stage. A good way to start the advice stage here, you want to get the patient permission first and use non-judgmental language and state your concern as a provider, setting the goal. Okay, so in my, there's a 4 foundation process. So it's engaging, focusing, evoking, and planning. So your planning, evoking, and focusing stages, those are your technical skills, and engaging is your relational skills. So it works from your bottom up: engaging, focusing, evoking, and planning. So with the engaging, that's where you're going to maintain and establish a relationship with your patient. And then you're going to focus on making an agreement, identifying a target for change. Then you'll move on to your evoking stage, which explores a motivation to change. And lastly, you'll get to your planning stage that develops of specific goals and plans of change in that stage, you'll build the confidence that encourage them to want to change, and showing them that they can, or encouraging them that they can change. So let's look at motivational interview. This is a big topic. I won't dig deep into this because we'll be here all day past this lunch hour. So this is just a quick view of motivational interviewing questions, what it looks like. You always want to avoid confrontational or labeling, stereotyping during the conversation. Asking those open-ended questions so that you can get answers, or encourage conversation. Because if you ask closed-ended questions, you would simply not make it far in the conversation. During the conversation with the patient, you want to be a reflective listener, encouraging them to talk, open up and talk, while offering non-judgmental information. And you want to make a connection with the person, and if they're being referred on to treatment, ensuring that it's a warm handoff and they're supported by you to that next level of supporting care. So brief treatment is used for patients with problems related to substance use, just simple, just referring them on for additional treatment and care. And then, of course, this referral to treatment is those that need more additional care for substance use. So how would we implement SBIRT in a healthcare setting? You're going to create the conditions of change. You're going to communicate, and you're going to prepare the workplace. So when creating the conditions of change, if you have outside influence or involvement from outside individuals, of course, communicating with them and implementing strict guidelines and timelines. You want to always prepare your organization financially, and also communication-wise, let them know what's going on. Change is something it's hard, especially when it's being implemented. It's challenging, but change management is a key term. It's an umbrella term that covers types of process to implement, to prepare, and support the organization through change. Make sure communicating effectively with the team, emotionally, and implementing any other things that the organization will need to make sure the change is effective. This organization, to change again, you want to devise a plan, acknowledge the practical realities of your organization. They can be complex, but it's essential to ensuring the organization's SBIRT initiative process is effective. Sustainability requires that the staff receive appropriate training, credentialing, and licensure for billing, and support to conduct SBIRT, including onboarding new staff and ongoing training for current staff and competency-based evaluations. So how overcoming resistance by change by clinicians, healthcare workers. So these next two slides, these are just the challenges you may face when implementing SBIRT. Of course, the culture change, you'll be faced with staff resistance. So you just have to continue to reinforce the strategies by leaders and for your staff resistance, of course, post-implementation and adjustments, staff education, lack of staff resource, you're gonna, of course, collecting data, using lean quality improvement methods. All of those are ways to approach these challenges that's faced in implementation for changes. So we're gonna normalize SBIRT and data to motivate the staff. Performance in reporting and metrics are great. You're gonna meet often to share the achievements and identify any goals. Creating data charts, creating identifying champions within the organization that will help report what's working, what's not, how to make the transition smoother, what can improve this process to help make this transition easy and, of course, effective to the patient that will be receiving the benefits of SBIRT. Patient and provider brief conversation examples. So these are just examples of what to say to your patients after they've completed that pre-screening questionnaire for the SBIRT. So if your patient identified as a low to no user, of course you acknowledge it's great, but talk to them about what happens if they're faced with hard challenges, or if they're faced with someone encouraging them to drink or use, or how would they use that. So just conversing with them to avoid it if they can, but if they do, how to do that in a healthy manner. So this is for your low risk individuals. This is an example just how to talk to them about the results. And like I said before, getting their permission and letting them know that as a provider, the best thing is not using alcohol or drugs, but helping them to identify where they are with their results, and give them goals. For an example, if their grades or regarding what you know about them, grades, diabetes, any health related issues that they may be having, why the risk of substance use would be detrimental, or how it's affecting that. So just creating a conversation around what you know about the patient to encouraging them to lower their risk. So of course, your moderate risk, you want to have a conversation with them. And this again is an example of that, and offering support, asking them how can you as a provider help support them to lower their risk from moderate risk, because if they continue on the path that they're on, it may increase to a more risky use. So we want to encourage them to lower the risk, and giving them options, asking how have they ever thought about quitting, how cutting back, what are reasons you would want to cut back, and again supporting, how can I best support you into lowering this risk. And of course, our biggest concern would be our high-risk users. And this is an example of how you start that conversation with the patient that's before you. And once you've talked about those conversations, giving that warm handoff to a team member so that they can receive any community services that may be available, any services that your clinic may offer, or anything that's valuable to them, whether it's an inpatient setting or outpatient setting where he or she can receive those services. These are my references. Are there any questions? Please complete the post-training survey by scanning the QR code.
Thank you, LaTasha. I also have a link that I'm going to drop in the chat. These are two separate evaluations. My evaluation is if you need continuing education credits for CHES, social worker, or MAP. And you must complete the evaluation to get those continuing education credits. LaTasha is for you, so they can receive information if they so they can continue to do these trainings, and so they can receive credit for the SUD team. Is that correct, LaTasha?
That's correct.
Okay. So again, thank you so much, LaTasha, for your presentation today. It's a quiet group today. No questions. Not one. I'm just kidding, LaTasha. They're quiet every.
No, that's fine.
They're quiet every webinar. So
they're happy. I gave them some of their lunch hour back.
They're really thrilled right now. So let me drop the link in the chat, and I'll give you. I won't get off if you guys have any. If you can think of any questions, we'll be here.
Thank you.
You're welcome.
There's the link for the ones that need. Oh, or if you need just a general attendance certificate, that link that I dropped in, that will give you that as well. And so everyone, we have one more presentation in this MSPQC SUD webinar series. And I think the final one is on May 1st. So they're being held the first Thursday of every month. And let me see. The title of that one is Treating Opioid Use Disorders in Pregnant and Parenting Persons. And it is May 1st, and it will be just like the same method. It will be a Zoom call, and you will have two evaluations. One, if you want a general attendance certificate or CHEST credit social worker map, or I think that's it, CHEST map social worker. So we'll see you guys in a little bit less than a month for treating opioid use disorders in pregnant and parenting persons. And that will wrap up our MSPQC SUD webinar series. We also have a syphilis webinar presentation coming up, and that will be April 23rd from 12 to 1. It's a Zoom as well. Yes, Kimberly, if you hold 1 second, I'll drop it in the chat for the syphilis webinar. Just drop in the chat for the syphilis webinar, the Zoom link for the syphilis webinar that is going to be April 23rd. If not, I'll email it to her. Oh yeah, she's still on here. No, Cheryl, there will not be CEs for the syphilis webinar, but there will be the same CEs for the last webinar for the SUD MSPQC series. Let me see. I'm just hanging on the webinar, but once you finish the evaluation, you guys can go have the rest of your lunch hour back. But if there are no more questions for myself or LaTasha, you can exit. LaTasha, you can probably go on. They didn't have any questions for you. I'm just leaving it open in case they have some questions for me.
Okay. I wasn't sure how long I was supposed to talk. That's
You did fine. It was
okay.
we just we just give an hour, but if you finish early, that's fine. I'm sure they were excited.
Okay.
They got a little time back in their lunch hour because a lot of people on the call are providers, and this
Mhm.
is the time that they have a little free time that they can sit and listen. But you should be free.
Okay.
Anybody else have any other questions for LaTasha before I just let her go? I'm still here if y'all need anything else from me in terms of the evaluations or anything like that. Questions about upcoming events with the PQC, I'm here. But LaTasha, I don't think they have anything else
Okay.
for you. So
Thank you.
thank you again for taking your time and doing the presentation. It was great information. Thanks again.
Thank you.
All right, talk to you later.
Bye, Candace.
Have a great day.
You too.
Thanks. Okay, everybody about done with their evaluation? Or do y'all need more time, or do you need anything else from me with the PQC? Okay, I think I'm gonna sign off.